ईस्ट श्रीलंकाशायर हॉस्पिटल की टीबी नर्सों ने दुनिया न्यूज से बातचीत करते हुए मर्ज के बारे में कहा कि अभी भी दुनिया भर में टीबी आम बीमारी है। उन्होंने ये भी कहा कि पाकिस्तान से टेस्ट करवाकर आने वाले कुछ लोगों में एक खास किस्म की टीबी हो सकती है, जिसके लिए उन्हें बरतानिया में मजीद टेस्ट और इलाज की ज़रूरत होती है। उन्होंने मजीद क्या कहा, आपको दिखाते हैं।
I'm Alex Mabry, one of the TB specialist nurses for East Lancs. So TB is a bacteria, it's an airborne bacteria that can develop within the body after exposure. It can infect any organ in the body, but the most commonly infected organ is the lung, and that's what we're trying to prevent, active TB.
My name's Melissa Gibbons. I'm one of the other TB nurses for East Lancashire. So the signs and symptoms to look out for when TB is mainly in the lungs is a prolonged cough for more than 3 weeks. It can be dry or productive, heavy sweating at night time, weight loss, unexplained fevers. Some later stages of TB can present as hemoptysis, so blood in the sputum that you're coughing up. Also, a loss of appetite, feeling very weak, very lethargic a lot of the time.
So there's two main types of TB. There's latent TB, which is when somebody's been exposed to the TB bacteria but they don't have any symptoms, and then there's active TB disease, which is more serious. It requires a longer length of treatment and it can possibly be infectious.
So, currently we carry out 2 types of tests. These are mainly detect for latent TB. One of them being is a simple blood test called the QuantiFERON Gold test. That's a standard blood test that's used globally, and we use the MAN2 skin test mainly for children. This is also mainly to detect for latent TB in children. For active disease, if somebody's suspected to have TB in their lungs, we would get some sputum samples, send those off for TB culture. You can also have chest x-rays, CT scans, and there is more invasive procedures that can be performed to detect for TB.
So depending on how compliant the person has been with the medications, that's one of our jobs, is to check compliance, that people do take the medications when they're supposed to and in the correct doses. Unfortunately, there is a small percentage that can experience reactivation if they haven't been compliant with the treatment. In that case, sometimes if we come round to a second course of treatment, the person may find that they are resistant to some of the main TB drugs that are available to us. So it may lead to an extended treatment period and a different regime of drugs.
So we'd mainly like to raise awareness that TB is still present, it's still here, it affects people in the community. TB is curable. Most people that take the medication for TB do so without any complications or issues. There's always support. The nurses are always here to support any patients that are on treatment for TB, and we would also arrange screening for family members as well.
Just to say that when new entrants come into the UK, we would invite them for screening. Sometimes, well, always as part of the visa requirements, they will have been asked to have a chest x-ray. This is looking for active infectious TB disease. So we're looking for latent TB, so just looking for any exposure. So if we invite you for some screening, please do attend, because it can help us to prevent TB spreading further.